My guest today, Veronica Zanca.
Are you telling me that they offer nothing in the way of endometriosis? Nothing.
On average, it takes 7 to 8 years after symptoms begin to receive a diagnosis.
I was treated for everything except what it was. Everything about me was healthy, 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 making me repeat what I'm feeling. Nobody knew what was wrong with me. Again and again, to repeat your symptoms because we don't see a problem here.
Multiple doctors were not able to realize.
There were days that I'd be suffering by myself. I couldn't get up to go out and fight.
And we are talking about the system that everybody thinks that is the best health system, medical system in the world.
Some of them very nasty.
At what point did you realize that your pain was being minimized rather than treated?
By the 5th doctor, I would wake up in the middle of the night with horrific pain. I'm begging for you guys to help me. I finally got in front of him in his office and I was so let down. I finally met a female nurse and she listened to my symptoms. Why can't we find better imaging to diagnose endometriosis properly? Nobody should be left suffering the way I was suffering. She's like this tiny little angel that came down for women with endometriosis. And, she's the closest thing or the best thing to a cure.
Welcome to Not Silent Podcast. More than half of the world's population is female. Yet women's health care is still treated as secondary concern. In the United States alone, over $450 billion is spent annually on healthcare research. But less than 1% is dedicated to conditions that primarily affect women over the age of 40. Women live longer than men, but they also suffer longer, experiencing nearly twice the rate of mental health disorder, often linked to chronic untreated pain. Endometriosis is one of the clearest examples. On average, it takes 7 to 8 years after symptoms begin to receive a diagnosis. During that time, the disease doesn't just affect fertility, it impacts the entire body, from the nervous system to mental health and daily functioning. Too often, women are misdiagnosed, denied coverage by health insurance, and treated in ways that are dismissive or even inhuman by the medical system. One of those women is my guest today, Veronica Zanca, who joins us to share what she endured and why her story matters far beyond her own experience. Veronica, thank you so much for trusting us to share your stories. Can you take us back to the beginning? When did you first realize that something was wrong with your body?
Thank you, Arbana. I'm gonna say probably around 2021-22. I was bounced around emergency room to emergency room because I was experiencing what felt like UTI symptoms, but there was a little bit extra. I didn't understand the pain I was dealing with. Also, none of the antibiotics worked. I was given a plethora of strong antibiotics and none of them worked. Or they would help me for 3 days, and one day later, I'm back in the emergency room. I was treated for everything except what it was. They went from pyelonephritis to a massive infection, although my blood work was normal. Everything about me was healthy, healthy, healthy. And I kept being greeted by different emergency room doctors making me repeat what I'm feeling. And when I'd ask, why do I have to keep repeating myself? They said, well, all your blood work's normal. Everything's normal. You seem to be healthier than any of us. So I asked what was wrong with me. We're not quite sure. So we're coming around to ask again and again to repeat your symptoms because we don't see a problem here. And so that's how it started. Then I would go to different doctors because I would Google my symptoms. Different OBGYNs would come up. The other thing I found horrible was I would find the doctors on, ZocDoc or different recommendations for specialists. And the worst part was that they had the nerve to list on their credentials that they are specialists in interstitial cystitis, endometriosis, but then when I would call to book, they would tell me something like, oh yeah, she has a few patients like that.
When you go to ER, you are very sick, so you are in a lot of pain. And you didn't just went to one doctor, which means multiple doctors were not able to realize. And we are talking about the system that everybody thinks that is the best health system, medical system in the world. So you've been going for years and they were saying to you that is UTI. So many of them were not realizing what actually you are suffering from.
Correct. Nobody knew what was wrong with me. They would throw a list of, hey, have you done this? Have you done this? Have you tried this? And I almost in a way felt like here I was the specialist and they're asking me if I've done this or done that. And there were several times where I'd end up saying, confronting them. You said you're a specialist. Why are you asking me? Some of them would Google right in front of me the symptoms that I'm giving them. And it became so frustrating because then I was faced with who is going to help me? I've been to every single emergency room. Here in New York City, we're supposed to have the best healthcare system in the world, and nobody could help me. I had visited different nurse practitioners in different clinics. Then I started going to women's clinics and begging pretty much. I would, in tears, I'd be sitting there telling them how horribly I'm suffering and how much pain I'm in. And they all said, I'm so sorry to hear this. We don't know what's wrong here. We're trying, but we can't figure out what's wrong. They started going in a completely different direction. They started referring me to urologists. I went to see one of the best urologists here, and he did a cystoscopy. My bladder was fine. Oh, you have a beautiful bladder, blah, 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 blah. Nothing seems to be wrong here. Okay, so then can you tell me, doc, what is wrong with me? Why am I experiencing
How this process, like this beginning, how long was this? Like until you start going to like just being diagnosed as UTI, how many times, how long? To what point did you realize that your pain was being minimized rather than treated?
by the fifth doctor? It was awful, and I really did feel so alone. I started to think either I had something that nobody knows about, some new crazy, disease, or nobody's really paying attention to what I'm feeling. There were days that I'd be suffering by myself. I couldn't get up to go out and fight for my symptoms, fight for some doctor to recognize what I'm going through and to help me. I had a list of things. I would wake up in the middle of the night with horrific pain and I would write down exactly what I felt. And then I would start my hunt again, going to different doctors and clinics, women's health clinics. Nobody really could put their finger, or they'd start asking me, do I have a diagnosis yet? No, I'm begging for one. I'm begging for you guys to help me. It was beyond frustrating. I felt extremely alone and I started to feel hopeless, like there was nobody out there that could understand my symptoms and what I'm dealing with.
So you were basically left to realize yourself what's going on with your body. What were you doing at the time? Just dealing with pain and not knowing where to go?
Pretty much, yeah. And nothing, by the way, there was no medication that was able to get this pain to where I can bear, where it was bearable. Ibuprofen, nothing would help and alleviate this pain. I had gone to maybe 3 separate OBGYN. They always try because, I'm 40 and they immediately try to get you on hormones it's a process of elimination type thing to see, oh, does this hormone work, does that hormone work. I must have tried maybe 2 separate ones, and then they discovered a regular birth control, which was estrogen mainly, a dose that sent me into a completely different pain spin of its own issues. It sent my body into almost immediate worse pain. Like the pain became exaggerated, and on top of that, I started feeling almost fever-like symptoms. I called the clinic. They said, okay, let's stop that hormone. Veronica, I'm going to put you on a different hormone, and you're going to take one a day. I started that hormone, which was a progesterone hormone. That almost cut the pain, but not quite. I called
But they were still not knowing why. They're still giving you this therapy without knowing your diagnosis.
Correct. It wasn't until I finally met a female nurse, and she listened to my symptoms, and I guess because she she's used to dealing with women in her clinic, she had an idea or an inkling of what my symptoms sounded like. And she put me on a progesterone medication that was made primarily for women with endometriosis. And, we tried it. It almost worked, not quite. And when I told her, she told me to take, I think, double, we dose. All of a sudden, it was like, okay, now they're kind of subsiding. So that's when finally we realized, okay, well, maybe, but it wasn't just endometriosis. There were maybe 5 or 6 different other types of issues.
But we have a nurse which is more capable of having a bit of what you are dealing with. So you already met many doctors at the ER, they have no idea. So you have a nurse that kind of, she started realizing because of your symptoms what you might have.
A female nurse, that's right. She was the only one that I felt listened to me. Before her, I was with doctor after doctor after doctor, some of them very nasty. Some of them that wouldn't even let me finish, explaining my symptoms. They'd cut me off, write me a prescription for, I don't even remember what they said. And I would always stop and say, you didn't even let me finish.
When you mention nasty, can you share with us what do you mean nasty by nasty? What would they say?
Almost as though I got the feeling that I was wasting their time, because I cannot tell you how many of them would look at me and say, you look fine. You look fine. In fact, you look great. I don't understand. You're sitting here telling me you're in horrific, horrible pain. I'd expect you to be crawling on the floor. Really? Why? Who's going to fight to get me, help?
So this is like being a woman. Like, how did being a woman shape the way doctors spoke to you and made decision about your body? This is what I'm interested to know, because these are male doctors that would treat you in this way.
Yeah. Yeah, mostly. In fact, all male doctors. One of them, I remember coming in, I was eager to explain. He was highly sought after. Everybody in the endometriosis world recommended him. And I was so happy to finally be a part, because then everything's waitlisted. You have a wait list for like a year. I finally got in front of him in his office, and I was so let down, because he asked me quickly, what do I do? What do I do have anything to do with my health?
How do you mean your profession? He was
asked me what do I do for a living? And shocked. And then
did they question your age or something?
Oh, yeah. Yes, he questioned my age after, the fact I'm a student and work part-time didn't sound great to him. He then asked me my age. I told him my age, and it was like what should have been maybe a 45-minute consultation turned into less than 5 minutes, because he cut me off, told me this is what happens. Any woman over the age of 40, you're going to experience a drop in or a fluctuation in hormones. So just do what you've been doing with your OBGYN, and, call me if there's anything more serious.
What is more serious than being in horrible pain?
Correct. I asked him that. And he said to me, I'm telling you what I do. I am telling you that you need to try other medications first before you come back to me. I do surgeries. And unless you want me to, perform a surgery of this crazy amount, I wasn't even diagnosed yet at that point. And I wasted his time. He ushered me out. And it was like, because there were so many other patients waiting and I didn't know what to do. I wanted so badly to scream out, help me, please. I need help. I don't know 100%. I haven't been diagnosed yet, but you're the person to diagnose me. You diagnose everybody with severe endometriosis. It was so upsetting to me. And then I started to think, oh my God, is this how these specialists all are? Because there were really only two others that were specialists in this field.
So you have 3 specialists in this field in this.
As far as I know, and I have researched this, I had to become my own advocate. I had to fight for myself because at this point, I even called, I called one of the big clinics and I was told over the phone that I would have to spend an exorbitant amount of money that I don't know anybody who's got that kind of money laying in their bank account. So anywhere I turned was a dead end or a road to.
You were left, so the system simply steps away and you are left by your own to figure it out.
100%. I didn't know. I thought I was dreaming many times. The whole time this is echoing in my ear. Every phone call I made, every amazing clinic that people tell you, call this clinic, call that clinic. I'm sorry, can I speak with the supervisor? How could you tell me it's going to cost me $5,000 just to get on the phone with a specialist? And I'm sorry, ma'am, that's what it is. Now, do you want
Veronica, what about health insurance? Doesn't cover this diagnosis, or so you have to pay all out of your pocket?
That's what I was being told, yes, by all these expert clinics and hospitals. Every answer, even the operators, the female operators that I'd listened to these numbers from, I remember saying, is this seriously? Are you telling me that they offer nothing in the way of endometriosis? Nothing. The girl said, I know. I can't believe.
How much did you pay for consultation?
Consultation, probably $1,000.
That took 5-10 minutes to be insulted like that?
To be insulted about my age and that I should get with the program. You're over 40. You're not going to have any children. Let's just rip out the uterus and call it a day kind of thing.
This is organized crime. Did you felt like this is just a business, that they don't have at least an medical ethical stamp towards you as a patient?
Yeah, in a way, it just felt like, how could this be happening in this country? This is New York City. This is America. We're always supposed to have healthcare of any type. Nobody should be left suffering the way I was suffering. I mean, I remember just anytime I'd show up to a clinic or some specialist doctor, I was always in tears, and I would always start out by saying, God, please be the one to tell me that you're going to help me, that you know what my symptoms are and you're going to help me. And it was always the same thing where I'd list my symptoms and they'd never actually tell me, okay, I know what this is. I have a feeling you have. Never that. It would always, the other thing was I was constantly sent for imaging this, imaging that, MRI, CT scans, ultrasounds, transvaginal ultrasounds, which, by the way, anybody that has endometriosis knows how horribly painful. You're basically sent into it's almost like an episode right? After transvaginal ultrasound, it's like a day or two later, you're sent into the worst episode of an endometriosis flare possible. Pain, spasming, fever, chills. Like it was almost as though your stomach is trying to come outside of you, you know? And I remember I lost count. I'm not even kidding. After the 15th doctor clinic where I had to lay down, get another, look inside my pelvis. And then I'm leaving there with no answers, no help, no nothing. They'll refer me. See, we don't really do this. That was the best part. I was always hearing, we don't really do this kind of thing. We don't treat this kind of.
Don't even know what is this thing. How can they just not treat what? Because they are not capable of knowing what you are dealing with.
Nope. And that's their answer to me. And I would always ask, but your website says that you guys treat endometriosis, interstitial cystitis, everything listed. And I would pull it up for them. And the doctor looked at me and would say, or the PA would say, I didn't write that. Okay. I mean, so what are you telling me? You can't help me? No, I really can't. Have you Googled? I mean, I could send you to some specialists, but I'm not sure that they can treat you either. And it was awful. And I would have to leave knowing that I am no closer to an answer. And now I know for the rest of the week, I'm going to have to suffer with another flare up of pain, spasming, horrific fever, chills. It was really beginning to feel very hopeless. I felt like I'm never, I'm going to die. I am never going to get anybody to hear me and help me. I was always almost envisioning while I'm dying on the floor in pain. I'm envisioning this superhero doctor that, calls me back, responds to one of my voicemails and says, Veronica, I'm so-and-so. I specialize in endometriosis. I do surgeries to remove it. I'm going to help you. That's what I was just praying for every day. You have no choice when you're completely hopeless. There's nothing left for you to do except pray and hope to God that somebody, you're this much closer to a real doctor, specialty surgeon that's going to help me, because this was torture. Nobody should be tortured like this.
Have you went close to one doctor that would open a door or be ready to do a surgery or something? So what happened next?
Okay, so once I found the right nurse who actually believed everything I said and told me, I believe you may have, this or that. You may have endometriosis, you may have interstitial cystitis, you may have both. The only way to diagnose endometriosis is through surgery. Endometriosis is not picked up on MRIs, CT scans, transvaginal ultrasounds, nothing. We live in the year 2026. We are in the technologic era. I don't understand how.
Why would they ask you to do all the screenings and all those if this really doesn't make any sense, the whole thing?
No idea. And I remember I had gotten so frustrated that I actually flipped out and asked, do you even know how to read this? To one of the, technicians and then the doctor that prescribed it. Do you know how to look for anything other than tumors or, the obvious? And sometimes they'd laugh. Sometimes they'd say, of course, and lie. And most of the time, they would say, well, no, we don't look. The only thing that comes up anyway is tumors, this, that, basically, cancer type of things. And I remember I was shocked that the only way to diagnose endometriosis is through surgery.
That will cost thousands of dollars.
It costs thousands of dollars, but if you go through your insurance, I'm going to tell you about that in a second. Very bad. I do remember asking why we don't have the advanced technology to pick up on endometriosis, because endometriosis comes up, it's either floating tissue. I believe some of them come in cyst forms, and the one that I have are adhesions and lesions, which you cannot pick up. No regular doctor can look at ultrasound or even an MRI CT scan and see that there's lesions. Also, it comes in stages. Now, once I got to the hospital, it was a women's clinic that specialized. As a matter of fact, I believe it was a cancer clinic. I can't remember the name of it, but it was a women's clinic through a hospital, and they were lovely. They were absolutely amazing in comforting me and telling me how, don't worry, we do this kind of thing all the time. It's 1, 2, 3, and you'll heal. It takes 2 weeks or so to heal. So once I did the actual diagnostic surgery, I remember about a week later, they called me up and they told me that I had stage 4 endometriosis. And it's definitely endometriosis. And I remember thinking, and I asked the girl, what does stage 4 mean? What does that mean? Is this cancer? I was in shock. And she says, no, the stage of the actual endo, let me think. So the stages just mean that you have a deep implantation of lesions, and they're even attached to some of your organs. And I remember I had asked her, well, okay, how do we get these off? Well, you could continue getting it's called ablation, where they burn the surface of the lesion.
Mm-hmm.
Now, I had that. During the diagnostic of endometriosis, they told me that they will burn the surface of the lesions that they can see. And I remember saying, okay, will that help? They said, yeah, you're going to feel so much better. Once that's done, they'll burn whatever lesions they can see, and then you'll definitely feel a lot better. Okay, great. Well, when I woke up from surgery, I had the surgery pain, of course. But then I remember I said, oh my God, I still have the pain. Guys, I still feel the endometriosis pain. And I remember telling them, they had mentioned to me that after the ablation surgery, that I wouldn't have to take the progesterone medicine anymore. And I remember I had to call the hospital. I let them know, and they said, okay, well, continue taking the progesterone medicine. And I remember saying, I thought I didn't have to after this surgery. So then they said, okay, well, wait until you come for your post-op. It's only been 2 days. Okay. So I waited for the second week. In the meantime, I had to be on just as much,
Yeah.
progesterone. And I came in, I was crying, and I asked them, I said, does this mean this didn't work? And she says, well, sometimes you need to get it more than once. I said, how many times? Well, sometimes people feel better after about the third, fourth, maybe more, depending on how advanced the endometriosis is. So at this point, I was again left feeling hopeless. I didn't know what to do. They started to tell me, if after the second or third surgery, if I didn't feel better, then what's the next step? Because I asked, what would be the next step? They said a hysterectomy. We take out your uterus. Now, I wasn't, the expert yet in endometriosis, because again, I thought I was going to be fixed here. I thought I was going to be, back to my normal self. So I didn't know much, but I remember crying. I said, is there really nothing more? Is there nothing more that you can offer me except to remove the uterus? What about the disease? Does the disease that's left behind just go away? And I remember somebody said to me in that, in these clinics, somebody had mentioned to me, well, Yeah, because endometriosis comes from the uterus. It's really just the uterine lining. And I remember thinking, okay, fine. All right, so maybe I have to, that's something for me to think about. But I didn't want to get rid of my uterus. You know, I felt like I'm not that old. You know, my own mother didn't go through menopause until 60. So I thought I had plenty of time here.
Yeah.
Now, right after I spoke with the clinic and they told me that the next step, if the next few surgeries of ablation don't help me. And by the way, I have to wait at least a year, I think it was 9 months to a year between surgeries. Now, I was at my wit's end with this pain because the pain was getting worse. I had to continue more progesterone medication because those 2 pills no longer worked. I was on, I can't even tell you how many more
So the
because
pain became worse. You had to
yeah,
use more.
worse, and it required much more progesterone. So now I remember when I went to do further research and dig even further into how to treat endometriosis, I found out that one of the worst things you can do is ablation surgery. Ablation, where they burn just the surface. I found out that not only, it's almost like I read that if you have a cut and the cut scabs and you rip that scab off, it's never going to heal. So, not to mention these adhesions, they implant and they go down really far. They're deep implants. And these endometriosis adhesions, lesions, they actually house their own blood vessels and their own nerves and nerve sensors, and they mimic cancer cells. So then I started thinking, oh my God, now
So you came to the point you are doing your own research to help you lead you to answers.
100%. I had to do everything. And mind you, this is while I'm in excruciating pain. And, there's the pain so bad you forget to breathe. And I remember at so many points I was begging, God, please let me just pass out at this point. The pain was so bad. Now, I did my own research, found out ablation surgery is the worst thing to do. But that's the only thing insurance covers. I said, my God, I got on the phone, with different insurance companies and I asked them, what is your, how do you cover endometriosis? And it was all the same thing that the clinic told me. And I remember thinking, oh my God, how are we going to do this? Then I also found out, because then I started reaching out, obviously the social media and the internet is wonderful. I reached out to women that have, other women that have stage 4 endometriosis. And I had found out that most of these surgeries, the insurance company will cover endometriosis excision surgery, because that was something I discovered was going to pretty much be my only hope. But the problem is insurance will not cover. They'll cover about an hour to 2 hours. This is what I was told. They will cover about an hour to 2 hours worth of excision surgery for the doctor and nothing more. So if you have stage 4 or more advanced stage endometriosis, again, you'd have to repeat surgery after surgery, more than one, time, definitely. Sometimes more than 3 times, because I remember meeting with a surgeon, that was covered by my insurance, and I asked her, am I going to wake up without any pain? And she said, no, I hope so. That's what we hope. That's our goal. I said, well, what happens if I have so much that you're not able to, get it all? And she just said to me, well, our goal is to get it all. And I said, but what if you can? Well, our goal is to get it all. But what if you can't? Our goal is to get it all. Okay. So I wasn't really getting any reassurance. I was so scared. I had already gotten a surgery. Now, mind you, if you've ever been through surgery, The best part of surgery, right? Everybody's nervous going under knife.
Anesthesia.
Well, the best part of surgery is knowing that you're going to wake up with the problem fixed. No more pain. So the worst feeling ever was going under the knife, and I woke up in more pain on top of the terrible endometriosis pain. That was the worst feeling in the world. And it became my goal to make sure I only got one, or needed, like one other surgery that got everything, because I didn't want to do this over and over and over again. And I honestly felt like my whole being, everything in me, could not handle another failed surgery. I don't think I could have handled that. So I wanted to make sure that this next time around, it was going to be completely taken care of. And I would wake up and be 100% back to normal and myself again. Because endometriosis does not have a cure. No cure at all. And they tell, it says that in any Google search you do, there is no cure for endometriosis in the year 2026. But if you look at all these foundations for endometriosis research, they're raising millions and millions. Everything I look at, I try to see different charities. There's a big one that all the celebrities come to in Manhattan. I think it's once or twice a year. They raise millions. Where is the money going to if we're in the year 2026 and we don't have a cure? This is just outrageous to me. It sounds
not just the cure, but also the diagnosis process.
correct. A better diagnosis. Why can't we find better imaging to diagnose endometriosis properly? Because I was 16 years old when I had to go to the hospital for period pain. I had my period, and I would end up in the hospital because the pain was so excruciating. I couldn't function. It was nothing that Midol would take care of. So I remember back then somebody mentioned endometriosis to me. Oh, you may have it. You have to follow up with your OBGYN. And I remember at 16 saying, why can't I do an operation to remove it? No, it doesn't work like that. We still don't know much about it. That was when I was 16. Of course, I followed up with my OBGYN every single time I went, because my period came once a month. I was told by at least 20 different OBGYNs that I would have to first have a baby. You're only 18, you're only 21, you're only 25, you're only 29, you're 30. You might want to try having kids, because having a baby cures endometriosis, which is the biggest misconception, around. That's almost like a wives' tale, because it doesn't work like that. But if I was diagnosed earlier, like when I was complaining first at 16, I would never have gotten to the point where I was a month ago and for the last 2-3 years. Never. It would have been completely dealt with and taken care of then. But no doctor had ever taken what was happening with me seriously. Even though I showed them hospital records, I had to be hospitalized. They had to give me, an IV of antibiotics and some kind of strong ibuprofen to help settle the pain, because the pain was unbearable.
You've mentioned that one doctor left you last minute when you scheduled the surgery and everything, and he said to you, I'm not going to do the surgery. So can you take us back to what happened with the doctor?
So I had, this was a doctor that was, again, if you Google endometriosis, excision surgery specialist, this doctor, along with a few others, is highly recommended for endometriosis surgery. In fact, I knew a woman, or I know a woman who had her surgery with him. She had almost the exact same endometriosis as I do. And I remember I was I thought she was like the answer to my prayers when I met her, because I remember I finally met somebody who has what I have. She almost confirmed that this is not some crazy thing my body is just going through. This is real. And I remember she knew much more than I did. But it was crazy because she also confirmed the things that I read and said, oh my God, yes, you cannot get ablation surgery for the stage of endo that we have. Oh, that makes it worse, because then scar tissue forms on the lesions, and it makes it 1,000 times worse with pain and also taking it out. This doctor, I met for the initial consultation. He was amazing. I mean, he presents himself amazing. And I remember he embraced me, we hugged. I became emotional because I said, I've waited so long for you. And he promised me, I'm going to help you. I promise you, I'm going to help you. Even gave me his cell phone number. And I said to him, Doctor, can we book the surgery now? He says, well, him too. He said to me, I want you to see a urologist. And I just looked at him for a second and I said, why? I just told you I went for a cystoscopy. I don't have anything wrong with my bladder. It's fine. Why would I have to see a urologist? Well, because, you mentioned that there's something with the bladder. Yeah. Isn't it endometriosis? Or isn't it because of endometriosis on the bladder? Well, I just want to make sure that, okay, fine. He gave me the urologist's information, and I remember I reached out to her immediately because he told me she was going to call me. Wait for her call. I asked him, is it going to be that day? Yeah, of course. I'm going to call her right now. Okay. That day I left, and, this was in October. I didn't hear. I waited till the end of the business day and I reached out. I tried calling him, no answer. I texted him, no answer. Because all I wanted to know was, I didn't hear from her. Can I reach out to her so that, I need this surgery?
Yeah.
Anyway, she finally I got in touch with her the following day. She told me that she doesn't work at where he said she worked. She was waiting for him to hire her, kind of thing. I don't know. There was some issues there. When I called him back to tell him that, he ignored me, never responded to me again. The secretary told me he's not good at responding to his messages. He will almost never return your phone call, but he is the best and he is the person that you want. Okay, so I didn't really take that whole issue too serious. His secretary, his office managers, and his nurse practitioners, they actually booked me because I said, this doctor doesn't exist. She doesn't do what he says. I'm waiting for him to, just respond and tell me, what do I do next? The office told me, don't worry, let's just get you on his surgery schedule. They booked me for November, toward the end of November.
Of the last year, like 2025.
Yes. And I remember I was elated. I was looking so forward to that because I was absolutely miserable. The pain had gotten worse than it's ever been. And I still had to, live, keep going on. And it was beyond debilitating. Finally, we get to November, I think 20th or 22nd. And this place was in Jersey. So I had my parents driving me all the way to Jersey. And I remember we got there. It was a little bit strange because they didn't have my name on the front desk schedule for him. And I remember the security guard told me that. I said, oh, she says, but that's not a surprise, Puts my name down, we go upstairs. They got me in a gown, the surgical cap. And I'll never forget, he came into the room with his, I guess, surgical trainee or assistant, another surgeon. And he told me that I was going to be in excruciatingly horrific pain. And I remember both me and my parents are sitting there saying, I was waiting for him to tell me it was a joke. Bad joke. And nope. I said, well, why would you wait till today to tell me this? Why couldn't you? I've been calling, asking to speak with him. I remember that whole week I had called his office and I said, please, I feel very uncomfortable not being able to speak with my surgeon before going into surgery with him. I just want to make sure he remembers me and we just have oh yeah, he will. Trust me. Yeah, he'll probably call you the day before. Okay, great. They even took down a message for me. I left him voicemails, text messages, and a message just telling him, please, I need to speak with you before going into surgery. He never called me, and his office assured me that he was just very busy. He's a very busy surgeon, and don't worry, he's going to talk to you before the morning of your surgery. So when he came in, he told me that I was going to be in excruciatingly horrific pain. When I asked him what makes me different than anybody else, he just says, well, it's the amount of progesterone you're on, blah, 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 blah.
But you have to take progesterone because you are in pain.
And I was told that I would have to come off of this medication for a while. And I remember saying, how is this even possible? I can't do that. I'll be in excruciating pain. Like, this is the only thing sort of helping me. Anyway, I got the feeling quickly that he was using this as an excuse. I can't say because after he told me that, and I insisted. I was crying, but I insisted to him, doctor, nothing can be worse than what I'm already experiencing. Please, I am here. Don't scare me. Please just continue. Let's do the surgery, please. Then he says, okay, you got it. I'll be back. He left me there for 4 hours. I had to call the pharmacy across the street from it was a medical center that I was in. I had to call the pharmacy across the street just to ask if my parents can pick up the medication because they were getting very upset that he left us and it's 4 hours later. The pharmacist told me, oh, Veronica, I'm sorry. The doctor, they had canceled your medication. And when I called, the doctor told me her surgery is being canceled. Cancel the meds. I said, what? How long?
He's telling you that the surgery is, and not the doctor or nurse, but you were staying in the clinic.
Correct. I was in my own hospital room. Nobody came to see me, and we thought that was weird. After the doctor came in, nobody, no staff, no nurse, nobody came back into my room. And when the pharmacist informed me that they canceled my surgery 4 hours ago, that's when we were just like, oh no, this is a nightmare. And that's when the hospital staff told me they had no idea. They had nothing to do with this. They were clueless as well. The anesthesiologist came up and started to tell me the same thing as the doctor, that, so sorry, but we don't want you to be in this horrible pain, horrible pain. So then I started to ask questions. Do you not have enough medication to treat me? I mean, what? This was just a terrible excuse. I realized quickly that this was some sort of excuse. I don't know. Maybe he didn't even know I was going to be on his surgical schedule. I mean, there had to be a reason why he never called me. He never returned
He could have told you earlier that.
Exactly. I texted him, I called him, I left email after email with his staff asking them to please put me in touch. Please have the doctor call me. And then the worst part was that after I had to leave, I left that night with no surgery, still in horrific pain, crying. And I remember I called his office right away to ask if they can reschedule. He never, ever, ever, nobody, not a secretary, not a nurse, not a physician's assistant, nobody from his office returned my call. Nobody reached out to me. Nobody. They just left me with nothing. And then I remember getting an email from his secretary a week, 2 weeks later, just telling me that the doctor felt that I would be better suited to have the surgery done in a hospital setting. I said, I'm sorry, I thought I was in a hospital.
Yeah.
What were we in if we weren't in a hospital? There was an anesthesiologist, nurses, a full staff, an emergency room. What were we in if it wasn't a hospital? I don't know. That was my experience.
Okay, so what happened next and after this? You were left, no one responded to you, and we were talking about the top surgeon, right, in New York. You went home, and what happened later?
So once I got home, I remember there was a specialty doctor, specialty surgeon for endometriosis that I remember. She was the person that I had actually had her on my list of people to call when I met the girl, who had her surgery done by that man. I remember thinking, oh, okay, let me go with somebody that I know had the surgery.
Yeah.
So I remember when I got home, I kept hearing her name, call her. I gave her a call, and I remember she spoke to me. I think it was a DM. I DM'd her first. She got back to me within seconds. And she was extremely helpful, asked me to send her all my, scans, all the history work from what I've had done so far. And she wanted to look at the post-op report, the full operative report from my last ablation surgery. And this way she got to see all the imaging and everything. And I had my consultation with her, and I remember she was so different. I didn't have to fight to finish my sentence.
Yeah. So you're with a female doctor, immediately you felt more better talking.
I felt 100% better. Like she was everything I wanted. I felt like I was talking to, aunts or a sister, because she asked me questions that nobody asked me before. It was a woman with a woman. She knew everything to ask. I didn't have to struggle to remember or go through my notes. The notes I had written down to avoid getting cut off by other doctors that were always in a rush. She listened to me. Everything. She actually was able to look at my images, and she said, oh, I could see just based on these MRIs, you definitely have adenomyosis, which is endometriosis inside the uterus. She was able to look at these images and know exactly, or have an idea of what's going on. I remember she told me it was going to be like a 15-minute consultation. She stayed on the phone with me for like an hour. Told me everything that would happen. Told me everything that she's going to do. And I remember I just thanked her. And the craziest part was, not that I would expect it, but I had explained the ordeal I had been through with the doctor prior. And, she's in the same field as her. She spoke so highly of him and, kind of just let me know, Veronica, I'm a firm believer of everything happening for a reason. For whatever reason, you were meant to be on my operating table, and that was it. And I remember that was music to my ears, because I am a firm believer of that myself. So it's like she said the magic words where I just was like, I know I'm in the right hands. And she did everything. I can't even, I remember telling her, I kept thanking her over and over before the surgery. After the surgery, the second week after, I kept thanking her because she got everything in one surgery. And she's like this tiny little angel that came down for women with endometriosis. And, she's the closest thing or the best thing to a cure. And here I am with my life back because she saved me. And it's only, it's because of her. She saved me. the fact that I did the research to understand and know what I needed. I spoke to some women and other women with stage 4 endometriosis as well. It led me to this female surgeon, and she just amazed me. And I don't understand, like, why we can't just have this in a regular OBGYN. Why is this so hard to find? She was a diamond in the rough, or a needle in a haystack. Why is it so hard to find a surgeon that can help you with one surgery? Why does it have to be so complicated? Here in this day and age, why is there no other help from anything? Why can't your insurance give you a list of names, like her, to do this? Why is it so hard?
So again, in this old system, there are still good doctors as the one you found. And all of the listeners, the women that are going through the same issue that you've been going through, so feel free to reach out. So we're going to provide you with the name of the doctor. But no one should have to become their own doctor to survive. And no woman should ever be told that pain is the price of being female. So your story, Veronica, is more than empathy. So it demands accountability. So this is not a women's issue. It is healthcare failure, and it concerns all of us. Veronica, I wish you all the best. Thank you so much for sharing your story, because your story is going to help other women who are suffering and who are going for years into what you've been through. So thank you again so much, because you are going to help a lot of other women by sharing your story.
Thank you. This is all I want. I want better for us. I don't want anybody ever to suffer the way I suffered. It's inhumane, and it shouldn't be. There's no excuse for it. We're supposed to have the best healthcare system in the world. So I just don't want anybody to suffer like this.
Yes, please, whoever is listening or watching to us, if you have any question, reach out to us at Not Silent Podcast in all social media platforms, on YouTube. And thank you so much for listening and watching. Thank you so much, Veronica.
Thank you, Arbana.